So before we hear from Dr. Pena, I guess I just want to talk a little bit about where this report fits in to the Bell's larger work. As many of you know, the Bell Policy Center, our entire mission is economic mobility for every Coloradan. And over the last 20 years, we've worked on a variety of issues, whether it's adequate public funding, addressing the challenges of Tabor, whether it's protecting Coloradans from predatory lending products, or whether it's getting into the policy weeds of how we deliver better healthcare, better child care, and prepare for a changing demographics in this state. I think some of you may recall that we did a similar report a couple of years ago around the middle class, and from our perspective, that was such an important project for us because so often, especially in this work, we like to throw around terms. We talk about poverty, we talk about the middle class, we talk about wealth, but we really don't have great definitions for those things. And 2 years ago, when we started looking at the middle class, it was very clear to us that this had been a conversation that had been neglected, that people had very different perceptions of what it meant to be in the middle class, what the bottom of that middle class was, and what the top of that middle class was. And when our report came out, I think it took a lot of people aback to learn that to be middle class in Colorado requires you to make at least 40 to $50,000 more than most people would imagine. And I think a lot of people were also surprised by some of the numbers that we and other organizations have released about wealth and income inequality, and in many ways, almost how little one needs to make to be in the top 1% of our economy. And so I think that this report that Dr. Pena has put together really, I think, is a great follow up to our last discussion of middle class costs and pressures and income, right? I think what she's done here is, first and foremost, I think she's really continued to help us and policymakers understand what the very real cost pressures are that Colorado families are facing. And as you'll see, I think one of my big takeaways from this is that there is an increasing population of families that fall somewhere between our perception of poverty or self-sufficiency and the middle class, that we have this growing strata of people who are somewhere in between and not quite being served by the programs that maybe we think are serving them. And then what I think is really critical and so important in this presentation is that it really begins to look at the relationship between economic mobility and public investment. I think a lot of us as progressives understand implicitly that when we invest in our public structures and when we invest in our communities, everyone ideally benefits. But there's actually very little academic data out there that tries to draw direct correlation and really try to study the relationship between public investments that we make and the actual benefit that people receive in terms of their own economic investment, their own economic mobility. And so this report, which you'll hear about in a moment, I think really starts to get at that. And of course, what I love so much about it is that it's not just a blanket, we need to invest more in our state and in our communities, although we do. What I really like about this report is it gives us an address and it gives us specific priorities, specific understandings of how we can make our public investments go farther, where we can make the most impact, and also to understand that there are some public investments that actually produce quite the opposite of what we're trying to accomplish. And so I'm really excited for everyone to get this deep dive presentation. So very quickly, let me just introduce our speaker. And, I was going to try to come up with some very suave way of reading her biography and looking at the camera, but I don't think I'm going to do a very good job of that. But let me just say real quick, Dr. Anita Alves Pena is a professor of economics at Colorado State University. Her research interests are in public sector economics, labor economics, and economic development. And her current research relates to effective public policy, poverty, education and skill, immigration and labor markets, among other topics in applied economics. Dr. Pena received her PhD in economics from Stanford University in 2007, her MA in economics from Stanford University in 2004, and her BA in economics from Johns Hopkins University in 2001. If you like what you hear and you want to experience more of her teaching, she teaches microeconomic theory, public economics, and microeconomics of development at the graduate level in Colorado State University. She also teaches undergraduate courses in microeconomics, economic metrics, public finance, and cost benefit analysis applied to local economic policy. So I am so thrilled that we were able to collaborate with her on this project. And I am even more thrilled that all of you are interested in her findings. And so Dr. Pena, I will hand it off to you, and I will see everybody on the other side for a fun panel discussion with the Bell Policy Center's policy analysts about the implications and reflections that we're thinking about following this report. Thank you.
Excellent. Well, I'm assuming everyone can hear me. First, I'd really like to say thank you for the introduction. And I also want to say thank you to Bell Policy Center for partnership on this project. I also want to acknowledge my co-author, Mr. John Singleton, who's a MA candidate in economics at Colorado State University. He contributed greatly to this report, and I believe he's also here on the line in this call as well. I also want to preface by thanking all of you for expressing interest in this work and joining the presentation today. As a lead into our broader discussion, I'll start by summarizing that this work is first about updating our understanding of the state of low-income people in Colorado and how characteristics have changed over time. And then secondly, the work is about state taxation and expenditure and what patterns in expenditure tell us particularly about public investment in Colorado, and also if and how we could be more strategic or more directed in this investment. So what do we know about poverty in Colorado? Well, first thing to note is that the percentage of people in Colorado who are at or below the official federal poverty threshold has remained relatively flat. That's the blue line in this image. However, even though this increased alongside population growth. And then furthermore, the red line shows a new group. That's increasing both in percentage and in the number of people recently. Here, the red is corresponding to the fraction of the population that's between poverty and the middle class. And you'll notice that there's an uptake at the end of the data series. We think of this group as being particularly vulnerable of poverty, as it's a group that's unlikely to qualify for government assistance programs, yet it's also a group that's not quite the middle class either by the standard definitions. So in order to further understand the state of low-income families in the state, we analyze characteristics of those who are below the middle class and look specifically at how average characteristics within these low-income groups have changed. While there have been movements over time in many of the socioeconomic characteristics that we take a look at, perhaps the most striking that we notice, and which is highlighted here on the slide, is the higher fraction of the poor that's college educated than in the past, and particularly in terms of having at least 4 years of college education. In other words, an increasingly larger number of college educated individuals is experiencing poverty. And this is a pattern that we interpret as being consistent with negative economic mobility. Basically, people in Colorado are getting more education, and it's not necessarily translating into income and well-being in the ways that we may be expecting. And this pattern is not unique to those who are below the poverty threshold in an official sense. If we examine that next group, between poverty and the middle class, those that we were noting to be vulnerable of poverty, we actually see the same pattern, which is also highlighted here. All else equal, I would say that a lot of this seems counterintuitive. We normally would expect more college to translate into more income and therefore to less poverty. But a nuance in that statement is the quote unquote all else equal part. because there are other things that are happening over this same time period in the state. And so perhaps most dramatically, the cost of living in Colorado is increasing in a way that incomes just are not. Average costs of living in terms of major categories. And here we're looking at housing, childcare, food, healthcare, taxes. They're increasing substantially. And we're illustrating here for a family of 4, but we would actually see a very similar pattern if we looked at some other family structures as well. Interrelated with our observation of these increasing costs, public aid at the current level just isn't enough to make a meaningful difference. In fact, among those in poverty, there's an ever increasing gap between income received and the amount needed to afford these basic costs. So in order to highlight this, we examined the self-sufficiency standard in Colorado. And so this describes the income necessary to support a family of a given size without public assistance in comparison to the poverty line, which is used to determine eligibility for many anti-poverty programs. In this image, we document the gap between the measures for a family of 2 adults and 2 kids. But again, we would have a very similar picture if we looked at some other family sizes, and some of those are illustrated in the longer report. These patterns illustrate that the federal poverty threshold is inadequate in describing economic mobility potential in Colorado, and that this is largely related to significant local costs of living increases. And so all of this really brings us back to our initial observation that the state has experienced rapid increases over time in population and in economic output, but we can't say the same thing about public funding. In fact, if we adjust for inflation and population increases, state expenditure just has not kept up. Public investment has not increased in most areas. In our report, we focus in on each of what are known as the big 6 general funding spending categories in our state budget, and they're depicted here on this slide. Expenditures in several of these categories have remained flat or have decreased per capita since the Great Recession in 2008. An exception in this series, the second line there in the lighter shade of blue, is healthcare. Though healthcare spending increases are distinctive because a lot of these changes relate to the adoption of the Affordable Care Act and the expansion of Medicaid, as opposed to being related to local decision-making. Meanwhile, categories that are traditionally associated with increased mobility, such as K-12 education and higher education, have either been flat or have seen a decrease in funding. This ultimately leads us to examine specific areas where public investment can lead to economic mobility by isolating impacts of funding by spending category. We do this by linking data from the Census Bureau, data on real people in Colorado, to actual changes in state expenditures by category that we've experienced here in the past. So this is really where I geek out on the statistical modeling, right? So our exercise was to perform an analysis of the changes in the probability of being in poverty based on an increased amount of funding in each of these big 6 state spending categories. And we simultaneously considered differences in these impacts across those who self-identify as white and those who are part of a community of color in the state. We wanted to be attentive to inequalities and disparities that have been widely documented outside of the report. So what are the results? Here's a summary picture. Right. So the first, to read these panels, we would be looking left to right in terms of public investment. The probability of poverty then is measured in the vertical direction in each of these panels. Red here is for white Coloradans. Blue is for communities of color. If less poverty is a good thing, then we would want all of these to be sloping downward. So glancing at this image and this comparison across all of these categories, it looks like we have a big mix of things. So I want to start with healthcare. So on the upper left-hand side, We see that here that an increase in health care funding is associated with a reduction in poverty for communities of color, though a slight increase in poverty for the white population. But we have an explanation for this. Since there are big differences in the likelihood of falling within healthcare eligibility requirements across different demographic subgroups in the state population, things that are related to income and to family structure. And so this finding and this category's relationship to the Affordable Care Act funding that we noted previously, it's really not unexpected. So we have an explanation for health. If we move to K-12 education, so in the middle on the top there, decreases in poverty are seen across the racial groups, which we are studying, when there's an increase in K-12 education funding. And so coupled with the possibility of intergenerational impacts, we find this particular category to be promising. This is particularly promising. Now, in terms of higher education on the top right, higher education funding is associated with a small but significant increase in poverty for Coloradans of color. However, non-Hispanic whites see a clear decrease in poverty. So we interpret the higher education spending category as really being a prime example of the need for targeted policy. We know that the cost of post-secondary education remains highly dependent on intergenerational wealth, on access to affordable capital. And we know that large student loans can have negative impacts. So this image suggests that more spending gets us part of the way towards supporting economic mobility, but it also means that we need to be particularly purposeful in the way that we direct resources to students in higher education. Now we have three other categories here. Human services is a category of spending that works with populations who are more vulnerable to poverty, and subsequently are the decreases in poverty that we observe here are perhaps expected. Though this is also a category that we might associate with more temporary sources of help and less with long-term impacts, or at least those would be less certain. For corrections in the middle on the bottom there, correction spending is primarily the amount of funds that are used for incarceration. A small amount in this category is going to re-entry programs. But we find that increased funding for incarceration, or for corrections here, shows the greatest negative impact on communities of color. Specifically, while increased incarceration spending has been associated with a small decrease in poverty for the majority white population in Colorado, communities of color have really experienced the opposite. And so this is a category that really gave us great pause as authors of this report. In the end here, judicial, a perhaps less expected finding is that overall, a positive case for increased judicial spending. Specifically, we found that judicial spending has potential to close the racial poverty gap in our state, right? Or at least to start to close the racial poverty gap in our state. We note that to fully understand the difference in impact across demographic groups for this and for other spending categories, however, it would really require a deeper dive into very specific programs that are funded within the appropriations budget in each of these categories. So to summarize some final conclusions, we find that increased spending on education, both K-12 and higher education, is particularly promising for creating positive net benefits in terms of economic mobility. At the college level, it's important for funding to be appropriately directed to students who would otherwise face large student loans for access and then be limited in their economic mobility due to substantial student debt. In contrast, we find that spending on corrections is associated with increased disparities, while spending in the judicial category could improve, minimize inequities if we're spending on equitable institutions, for example. Finally, I want to mention that we started this project right as COVID was starting, and our available data predates the pandemic. We therefore make a final point that declines in public investment today can have long-run impacts, and our current circumstance really strengthens the argument to be directed and strategic in our spending as we go forward. So I want to thank you again all for your attention to this study, and please do check out the longer report on the Bell Policy Center webpage. Thank you.
Thank you, Dr. Pena. And this is Tyler Jaeckel. I'm the Director of Policy Research at the Bell Policy Center. Before we hand it off to our distinguished policy and research team, I just wanted to ask a few questions that I think have come up as the report has been released. And the first one, I mean, we love geeking out on different on different tools and statistics here at the Bell, but just really diving into one of them, your report uses regression analysis to evaluate the different forms of spending. And for many non-statisticians or people that like to geek out like us, this can kind of feel like a black box that you kind of put the numbers in and then it comes out with this calculation. Can you explain just a little bit in layman's term kind of what you're doing with that tool and what are some of the limitations of that tool as well?
Absolutely. Thank you for the question, Tyler. So regression analysis is a technique that statisticians, economists, and some others as well use to isolate the impact of a change of one variable on another variable. For example, in this research, we wanted to know that the impact of changing state funding in one budget category on the probability that a family would be low income or below the middle class. But we also know that there's all kinds of other things that impact state spending and poverty outcomes at the same time. And so the statistical process that we're using here, this regression analysis that you're describing, allows us to input all that other data into the computer at the same time so that we can statistically account for a wide range of observable characteristics that we have on families in Colorado and also on macroeconomic conditions in our state. So we're accounting for all of those additional things. And then we're doing this separately for those who are identifying as white versus those who are identifying as part of a community of color. Now, in terms of the limitations, we're definitely limited by the available data. We use the Colorado Big Six spending categories, which are very, very large categories, right? There are several programs, lots of different items to be funded within those. And so this type of really large aggregation can mask some of the nuances of specific programs. And so that's suggestive that we really need to continue with more work to delve into those categories, see what the specific drivers are, determine what's reproducible, what's scalable, and what's really not. And we definitely have a lot of really smart and professional people in this state. And we have people who are working in education on the ground, judicial services, health and human services, they're working in corrections. Some of those people may be on the call here tonight as well. And so I really think of that group of people as people who really represent the next step in terms of identifying what spending elements are really important within these large umbrella categories that we're looking at. Another thing is that our data ended in 2018. We know that there have been all kinds of changes in well-being and in jobs and in tax base associated with the pandemic. And so we really need to be forward-looking and updating to those types of things as well, and really being attentive to which costs of living and which incomes are shifting, which groups. We know that we all participated recently in the 2020 census, and so we know there's more information coming. We know that there was updates of other surveys as well, and so I'm definitely looking forward to next steps, continued partnerships as well. Thank you.
Wonderful, that's exciting. We look forward to the next step. I guess another part that we didn't talk about is you also really look at kind of public spending's effect on home ownership rates for different types of Coloradans. And so I guess my question is why? Why did you look at that, and what did we learn from that as well?
Yeah, so many economists and others too think of home ownership as having relationships to wealth. We therefore also had a secondary exercise in the longer report where we estimated the probability of being a homeowner as a function of the state's spending in a way that was very similar to the modeling that we did for poverty outcomes in middle class that I just presented here. We did this to derive additional results and to build intuition about longer term economic mobility outcomes here. There are gaps which we document in the report and which we're probably all aware of between homeowner costs and rental costs in Colorado. And rental costs are just increasing more quickly in recent history than homeowner costs are. And so this translates into lost wealth and lost opportunity for wealth building in the form of foregone home equity, for example, for some residents in the state, and that's likely to have long run impacts. So it's very complementary to look at that as well. Also, that home ownership would be reflective of some longer run trends and some historical persistence in budget numbers as well. And so it was a way to get at that. I'll also point out that affordable housing is an issue up and down the Front Range. It's also an issue elsewhere in Colorado. And so our analysis provides evidence consistent with how a lack of affordable housing can detract from the health and the wealth of our population, can increase some inequities along demographic margins, which we study. And we highlight throughout this work. And so we also show that increasing higher education funding specifically provides some favorable outcomes for wealth building in terms of home ownership. And so we think that's an important result to bring into all of this as well.
Well, I know we're starting to already get good questions coming in. So I'm gonna hopefully hand it off to Scott here in just a second. But the last one, which is the policy and research prerogative, is just K through 12 education is a pretty large finding. We know that in some ways outcomes related to K through education can lag over time. So whether or not you completed school, you might not see that in economic kind of data until later in life. How did you deal with that lag and kind of, how did you deal with that lag?
Well, the data that we have access to really starts in a meaningful way that we use in this project in 2005. And it's data that's not really intergenerational since we have households that are only observed once in the survey. And so this is another limitation because what we're capturing with those results that you're mentioning here is really the indirect channels between public investment of kids in more or less current times and their parents or guardians' income now, or very close to current times as well. So that's very different from spending on a kid who then becomes a working parent over a longer period of time. That's also definitely of interest. It's definitely of importance too, but that's not what we can do with the data that we have available at the moment. So ultimately, since we're looking at outcomes of the family now as a function of spending that was not so long ago, we're really interpreting our results as picking up aspects of costs that are faced by households. So if kids are being taken care of in school in our state, well, then the households are just better off. And that could be related to things like time use and budget allocations within the family. So at the family level, it could also relate to how the family just feels better and able to take care of itself when school systems have resources that are supporting kids to a high level. We're also using, some statistical methods to allow us to pinpoint the association between state spending and poverty outcomes while netting out the impact of education levels on the household's heads. Since that is something that's available and observable in our data. So that's a different layer to this as well. But we really think that the analysis at the end of the day just really confirms that it's important to target specific communities and groups and to be really purposeful in spending so that we can maximize these types of indirect impacts that would be strongest for groups that need the investments most because they're currently receiving the lower levels and the lower qualities of educational resources than elsewhere in the state.
Well, Thank you very much for entertaining my questions. I'm going to hand it over to Scott to do a broader kind of discussion, but just wanted to thank you again for this research. It touches so many of our areas of the Bell Policy Center, and hopefully, as you can see, as our policy staff really engages in it, there's many things to continue to build out and dive in deeper. So thank you very much again.
Absolutely, thank you.
Yeah, so, well, great. Thank you for that presentation. And now, so we're getting a couple questions in the chat, but I actually feel like pretty confident that we're going to touch on many of these questions in our panel discussion. So for folks who have posted questions in the chat, thank you. And I love that we've also got John Singleton, who actually helped out, worked on the paper with Dr. Pena, answering questions in the chat. And we also have Bell's staff posting a few links here and there to information that sort of touch on some of the questions. So let's kind of go to our panel, and I assure you, I will stop this panel at like 5:53 to make sure that if we haven't answered any of the questions that come up, we'll get to them. So I'll tell you what, when we were putting this together, at first we thought, oh, let's put together like a big fancy panel, and let's have like, you know, like a state legislator and like the director of the Department of Higher Education. And those are all awesome people and they really know their stuff, but actually their schedules are really hard to navigate. And it occurred to us that we actually have some really awesome people on our staff who maybe not everyone gets to interact with if you work with us. But we have a whole team of policy analysts, and they are really the backbone of everything we do, doing research, looking at many of the questions that Dr. Pena has touched on and raised. And so, so that's what we're going to do. So here's what we'll do. I'll kind of ask a question of each one of our policy analysts, and then that will be your opportunity to introduce yourself, and then you can opine, and then I'll cut you off if you're going a little too long. So first of all, I would like Laura to maybe talk a little bit about what we're seeing here with higher education, right? I mean, I think that for all of us like to believe that, you know, we invest money into higher education, and when people go through the post-secondary education system, that should more or less guarantee them a different trajectory in terms of economic mobility. But this data seems to be suggesting something a little different. And I think that it kind of nags at all of us, and it makes us wonder, you know, what is the best way to spend higher education dollars? And is higher education even a guarantee of economic success? So Laura, great to have you here. Would love to hear your thoughts and reflections on some of the higher education data that came out of the report.
Sure. Well, hi, everyone. I'm Laura Valle Gutierrez. I am the Senior Policy Analyst at the Bell, where I focus on post-secondary and future of work issues. So, Scott, you raised this dichotomy that we see in terms of outcomes for upward mobility with our education investment. So I think one of the things that we've seen very clearly is that post-secondary education is still one of the best vehicles for upward mobility that we have. But attention that this report is showing is that our state isn't allowing this investment to translate for most students of color. Our spending hasn't led to the outcomes we want, partly because we're 45th in the nation for per capita spending in higher education. But I think what you're really asking me to home in on is this disparity. And so I think there's a few reasons why this could be happening. The first, Dr. Pena already alluded to during her presentation, which is we need to increase spending in higher education while really directing our investments towards the communities that are most in need. You know, in Colorado, half of students of color are attending either MSU Denver or a community college. So I think we really need to meet students where they are, and affordability of institutions where Coloradans of color are attending is an issue. So our chronic underfunding, you know, where we haven't really seen our funding return to pre-recession levels still, this needs to be addressed progressively to address the gaps that we're seeing in outcomes of mobility for students of color. And then I think the second part, which some of the comments in the chat we're getting to, is this challenge on the return on investment of credentials. So in my opinion, there's two big parts of it. First is that communities of color are less likely to be receiving credentials that align with industry needs. So for example, students of color are less likely to major in STEM degrees, which will provide a higher return on investment due to just industry demand. And also there's the fact that industries are not necessarily rewarding credentials for students of color. So we see this illustrated in pay gaps and underemployment for people that have the same degree. So that's the first part of it. And then I think the second part of it is, as Dr. Pena mentioned in her presentation, credentials are more expensive for communities of color because of the racial wealth gap, because these students are more likely to take on student debt to be able to afford these credentials in the first place. This directly decreases the ROI if a credential is more expensive. And this is especially true when students aren't completing their credentials. So I think there's a few things that we can do to help solve these issues. First, directing dollars to institutions to keep education affordable, especially at these places where we know students of color are more likely to be attending. And then there's a lot of innovations that we've seen sort of piloted in Colorado to help address some of these return on investment components. So this can include stackable credentials, which are short-term credentials or certificates that can stack into larger degrees and then also are directly aligning to industry needs. There's better navigation services to help address some of the completion. And then there's other mechanisms to help address affordability like emergency grants, debt forgiveness, and so forth. So I think this is a really concerning inequity that's being highlighted, but we do know what the promising solutions are. I think it's just a matter of prioritizing equity in our policymaking moving forward.
Great, thank you. And all right, so as to not put you on the spot, but I guess I will ask a question of you to maybe think about while your colleagues are talking about some other issues. But if we have time, I would love to hear from you. I mean, what are some of the bright spots? You know, where do you talked about those innovations. If we have time, I would love to hear from you about maybe, where you see bright spots in our higher education system, because I know that's a question we always get is like, okay, well, what's working? So maybe think about that. And then I guess I'd love to talk to Nazia, who is our policy analyst who focuses on a number of topics and especially working on childcare issues. And Nazia, welcome. So, I mean, it's not a secret that childcare costs have been exploding, but it really looms large in this report when we look at the costs that are driving up the cost of living. Childcare is a huge culprit. What do we do? I mean, this is a question that comes up all over the place. How do we reduce costs in childcare while at the same time not skimping on quality, which we also know is critical for student development?
Thank you, Scott. Those are really good questions. The answer is we just don't have adequate funding to support or make any progress in addressing the cost of childcare. And as we think about solutions, there's two major issues that we want to really look at that are really affecting these issues of the cost of childcare. One is the importance of childcare is getting much bigger as our economy has changed, and families with two parents most often are in the workforce and they are now relying on childcare. But for families to maintain self-sufficiency at any level, it's becoming more and more difficult, primarily because of the cost of childcare. And the second thing that we should be looking at is that our economic model of childcare, especially in Colorado, is just not sustainable. Mainly because the cost to provide quality childcare are expensive. And there's various reasons why it is expensive to provide quality care, health and safety standards, regulations, training, but it's expensive. And the younger children, it's more expensive to provide childcare. And we just don't have adequate funding to better support providers that are providing this quality childcare. There have been some solutions that have been proposed at the federal level, which can help offset the cost of childcare to families by increasing public investment. There's ideas like basing childcare costs on household income and using like a sliding scale fee structure. But the reality is that without public investment, these solutions just cannot advance. This is also something that the Bell is looking at how can we make the economic model of childcare more sustainable. But the biggest challenge that we come across is, do we see childcare as a public good? And can we find the funding to really support childcare? And the answer right now is no. We don't have the funding, and without that, the cost of childcare will continue to increase.
Yeah, and just as a quick follow-up, in the last election, voters approved Prop EE, which created funding for universal pre-K. You want to just talk real quick about, that's more money. Is that gonna, I'm hearing from you, that's not gonna solve all of our problems. So I don't know if you want to just touch real quickly on what some of the challenges are for the entire childcare ecosystem as that money comes in.
Yeah, while it's a really good one step forward for Colorado to have pre-K expansion, it is limited to the number of hours that families can receive preschool. And so when we look at the public funding that's available, we can't have one stream funding only 10 hours of care during the week. Where are the children going to go for the remaining hours in the day and the week? And how are we going to fund the teachers? We can't just pay teachers or the educators for 10 hours a week. And the other challenge is the pipeline. Do we have enough educators who have the credentials to provide the quality care that we need with this increase in funding in this new funding stream? And third, the challenge is, how do we include community providers? So right now in Colorado, when you have licensed childcare in various settings, you can have them in, childcare can be provided out of the home of a provider. It can be provided in the school district, and it can be provided in a center. But we want to make sure that this funding stream is inclusive of the various settings that are out there that really meet the needs of families, so families can have a host of options that meet their specific needs.
Great, thank you. Okay, I need to police myself. No more follow-up questions for me. We're gonna run out of time. So thank you, Nazia. Andrea, one of the things that comes up in this report is, low-income and vulnerable families are getting older. We're a demographically changing state. You wanna talk a little bit about what's going on here, and what are the implications for public policy when we see that we are just on average dealing with an older community?
Yeah, thanks so much for the question, Scott. And as Scott mentioned, Andrea Kuwik, and I think one of the things that I think Dr. Pena's report included in, as you had just mentioned, Scott, our state is demographically, we're aging. We think of ourselves as a pretty young state here in Colorado. And I think, we are a pretty young state, but that really masks the fact that we are one of the fastest aging states in the country. Regularly, depending upon which segment of the 65 plus portion of the population you're looking at, we're regularly within the top 2 to 5 states that are aging, right? So again, young, but aging very quickly. And I think to the second part of your question, Scott, I think that has a lot of policy implications as we think about things moving forward. And one of the things that we've really been looking at the Bell is then saying, how can we ensure that all of the policies that we think about moving forward, how are we looking at them through an age-friendly lens? And some of that will require thinking through, sometimes we need additional programs, sometimes we need additional supports, things like that. But oftentimes it's saying that the policies and the programs that kind of holistically we're looking at, or the policies and the programs that are already in place, they weren't crafted with the fact that towards that lens of saying, how does this work for people across the age spectrum? So I'll just mention really quick, as we have, one of the things that we're really looking at it, and I think, again, it really connects to Dr. Pena's report here, is that as, kind of the vulnerable population, both in both of those, spectrums that you had mentioned, Scott, as that continues to, as people continue to age, we're seeing that the workforce in general is also aging as well. And a large portion of that is also that people are finding that they need to continue working, but our policies that we have in place currently, and they're not intentional, people never created these policies and said, we're going to intentionally not support older workers. People just didn't think that people would be continuing to work past, the age of Social Security. And so our policies that we have in place now, they aren't looking at it with this age-friendly lens. So just a couple of concrete things that I'll mention that as we think about these, just specifically from the workforce perspective, one that I'll mention, just kind of like jumping right into legislative session and stuff here, thinking about age discrimination policy, how can we make sure that age discrimination treated the same across the board? Currently, that's not the case. As we think about, other things as well, we created an actionable aging policy agenda. Our workforce development supports, they often don't work as well for older Coloradans than for older workers. And the final thing that I'll just mention, and again, we mentioned it in the actionable aging policy agenda, is that if we think about the earned income tax credit, it's worked really well for so many different Coloradans, but it stops at the age of 64. And again, for no other reason than the fact that people just didn't think about people moving forward and kind of working past a certain age. So I'll stop there. But again, I think one of the really important things is really just looking at things through an age-friendly lens.
Yeah. Okay, great. Thank you. We're running out of time. I think there's a theme, though, that I pick up in what you're talking about and what we just heard from Nazia, which is that our economy is changing, right? Like the reliance on childcare in those younger years, the expectation that older Coloradans now need to work when previously they may have retired. So this theme of a changing economy definitely coming up a lot. All right, we got like 5 minutes. So Taku, in 2 minutes or less. Yeah, I mean, what I think we're also seeing in this report is just income insecurity, right? And so when we have so many people who are simply not making enough to make ends meet and to be self-sufficient, they obviously turn to things like loans, looking for ways to get as much credit as they can to make ends meet. You want to talk a little bit about our Office of Financial Empowerment concept and why we think that's part of the solution?
Yeah, thank you, Scott. Hello, everyone. My name is Takudzwa. I'm the Public Interest Policy Fellow at the Bell this year. So first off, what a statewide Office of Financial Empowerment would do is chief goal really is to grow the financial resilience of Colorado's residents by using community-derived goals and strategies. And it will achieve that goal by, number one, increasing access to safe and affordable banking and credit, providing the tools to better navigate financial shocks that many families in this vulnerable category have experienced due to COVID. And some things that help with that are things like financial coaching and helping residents build savings, as well as put up a proactive infrastructure to enhance consumer financial protection and keep the market free from predatory loans and products, which people frequently turn to in order to fill gaps in their income, whether it's through that come by because of unemployment. So as a result of COVID, we're seeing what happens to people in this vulnerable category when they experience an economic shock. When people are living paycheck to paycheck, they come where they're in economic crisis, which is why we're seeing increases in borrowing to meet expenses. And COVID exposed a deep problem in the system where if people lose jobs and don't have anything like savings to cushion that income loss, the floor just goes out from under them, and options for adequate supports are limited or bad in the case of predatory lending, as I mentioned. So a statewide Office of Financial Empowerment would help manage these setbacks by connecting residents to systems that can assist them, like unemployment insurance, as well as putting them in touch with affordable loan products and as well as safe banking products. In addition, I also want to mention that in recent months, due to this recession's job losses. We're seeing families that were previously middle class become downwardly mobile and see support from municipalities with identifying and engaging public health with meeting expenses like rent, but also generally how to manage this situation that's new to them, where they have to budget a drastically reduced income. I think a statewide Office of Financial Empowerment can play a crucial role in getting these people the help they need by providing access to things like resource navigation and financial coaching. So I mentioned as some resources that
I'm gonna have to cut you off because I got one more question, but I think you did an excellent job covering a really complex topic, and I just want to respect everybody's time. So real quick, just Josh, you're gonna get, I guess, kind of the last word on this panel, and I hope for folks, like, this is what we do all day, right? The Bell Policy Center, we try to cover the gambit. We work on all of the different issues that I think Dr. Pena's report, shined a spotlight on. Of course, almost every single one of our solutions requires money. And so, Josh, just real quick, if you just want to round out some of the things we've talked about here, we don't have enough money to fund every great idea. There's two sides of the ledger on a budget. Do you want to talk just a little bit about some of the choices that we think, legislators at the state capitol might need to start making to make the most of the limited resources we have in the state for some of the kinds of work that we're talking about?
Sure. So I'm Joshua Mantell. I'm the Rapid Response Policy Analyst, focusing mostly on tax and fiscal issues. So I'm happy to take this one. Really, one of the things that we focus on is not just how much money we need to fund these important programs, but how do we get that money in a more equitable and fair way. Colorado, due to a lot of the constitutional constraints that are in our system, has a very upside down tax code. We expect those at the bottom of the income spectrum to pay much more of their income and taxes than we do those at the top. We've been piling sales taxes in local governments over and over again to try and make up for some of these funding gaps that we see. And so one of the things that the Bell Policy Center is trying to do is really focus the conversation on who pays for these programs. Do we ask people who are barely scraping by, communities of color who are overrepresented in these categories, to keep putting more pennies into the jar? Or do we ask the wealthy and the people who have already made it to maybe put a little bit more of their income in to help the rest of our state really make ends meet? And so, legislatively, that means maybe looking at our tax code and seeing what kinds of tax breaks and tax loopholes do we give to the wealthy, to corporations, to big businesses that maybe we don't need to give them anymore, and that maybe could go towards funding education or funding, the earned income tax credit and the child tax credit. And then, of course, we have to look even bigger than that at the ballot and say, okay, do we need a better system, a better tax code that can actually help us long-term make ends meet on a regular basis for our state and increase the funding in these areas that Dr. Pena has been talking about that really do contribute to the anti-poverty goals that I think we all share. And so it's really looking at that other side of the ledger as well as the budget itself on how do we do this in a way that makes sure that we're not continually putting it on the backs of the people who are constantly paying and working to try and make ends meet here.
Yeah, thank you. So, okay, well, first of all, I just want to thank all of you for sharing a little bit about the way your particular policy area touches on aspects of the report that was presented earlier. I guess what I would say for the larger group, because I want to respect everybody's time and we promised to end at 6, is that, for me, this is the sweet spot because, we are a research and advocacy organization, which means that we do analysis, we shed light on problems and challenges, and then we actually, together with a whole bunch of other organizations and individuals in our ecosystem, go to the Capitol and advocate for policies. And I think one of our core beliefs at the Bell is that, we can actually change. What Dr. Pena's report served up to us is a picture. And one of the powers of policy and advocacy is that we can change that picture, and it doesn't have to look the way that it looks today. And so by working on issues like aging, by working on issues like financial empowerment, tax fairness, childcare, higher education, each of these issues, if you follow the news, I guarantee is going to pop in this legislative session and be manifested in the form of the debate. So we encourage you to be as active in that debate as you feel comfortable. Your voice is important. And, if should you see fit to support organizations like the Bell, we think we do important work in terms of serving these issues up for legislators and giving them options and not just a critique. So please definitely visit our website to learn more about the work we do. Spread the word. Please share the report. And make sure you get our email updates, because we are always updating our supporters on how these issues are unfolding. So with that, thank you all for showing up for this event. We really appreciate it. Dr. Pena, thank you so much for your work on this report. And for the entire Bell policy team, thank you for working a little bit late today and helping to pull all of this together and make it run smoothly. So thank you all, everyone. And if you have additional questions, don't hesitate to reach out to info@bellpolicy.org, probably the easiest email address I could give you. And we'll try to get your questions answered. So thank you so much for your time, and I hope everyone has a good, safe evening.